All right, hi you guys. Thank you for watching my channel. So I have had my pre-surgery appointment. I had two separate appointments. I had one with my OBGYN and one with the hospital that I will be in after my surgery is complete. So at the first appointment, I was basically given a list of do's and don'ts. And so, of course, on there, it talked about stopping any type of pain meds a week prior to surgery, any type of blood thinners if you're on those a week prior to surgery. They did recommend only Tylenol if you just absolutely had to have something, but not excessively. And so they also gave me the rundown on the morning of surgery. You need to make sure that you are not putting on any lotions, any perfumes, any deodorants, any makeup, no jewelry. And then they also, for me, they called into my pharmacy some Pepcid and Reglan. These are to be taken the night before surgery and the morning of surgery. And they are given for acid reflux and nausea to come that after surgery, which I'm grateful for that because I definitely don't want to have to deal with any of that. And they also told me that you need to brush your teeth for 2 minutes on the morning of the surgery. She was really like, set a timer and brush your teeth for 2 minutes the morning of the surgery, because basically they want to do all these things to make sure they can keep down infection. No shaving was also told because they want to keep down the chance of infection. Although I know we probably all want to do that, but obviously these are things that run the risk of infection, and they definitely want to keep that down. So they also gave me a special soap to bathe with. I don't know if you guys can see it really well, but this is the soap they gave me. I have to bathe with this the night before surgery and the morning of surgery because they're going through great lengths to make sure they can keep down any type of infection. And I'm really appreciative of that. So, of course, with the nurse, she basically said that my check-in would be at 6 a.m. In the birthing center. And then after that, surgery would be a few hours after that because, they'll get you prepped. And the doctor is actually going to come in and speak with you prior to performing the actual surgery to answer any additional questions you may have to have in reference to that. So that was the gist of that appointment. And from there, I went to the appointment at the hospital that I would be in. This was a very thorough appointment. When I got there, they took all my vitals. They took my blood pressure, my heart rate. We went through all of my medical history. They answered any additional questions I may have had. They did discourage taking any regular meds the morning of the service, of the surgery, but you are encouraged to bring those medicines with you to the hospital as you may need them, after surgery. I was giving a EKG, a X-ray, a urine analysis test, and blood work. And honestly, I wasn't prepared for all of these things. I had no idea I was going to do all of these things there. And I had to go from this department to that department. Y'all, I probably said my birthday so many times because, you have to verify your birthday each department you go to. But I'm appreciative that they go through all of this testing to make sure you're good prior to surgery. So I love that they're making sure that they're taking good care of me. My surgery is scheduled for April the 8th. And so I'm just going to continue to take y'all on this journey with me. It will be about a 90-minute surgery. It is a laparoscopic surgery. So I'm going to take you on this journey with me. My next video, I will be posting some of the things I'm doing to prepare my family, as well as some things I'm purchasing in order to have a great recovery. Thank y'all for watching.